Welcome back to MedTech Unplugged, the Navro podcast where we pull back the curtain on the medical technology industry, focusing on how to get in, how to grow, and how to make an impact. I'm your host, Jenny Adamou, the founder of Navro, the online recruiting platform built exclusively for MedTech careers. In today's Ask Me Anything question, we have a write-in from a senior at Georgia Tech who emailed us saying, I'm about to graduate with a biomedical engineering degree, but I don't have any internship experience. How can I still get noticed by MedTech employers? Let's talk about that. Well, firstly, congratulations on your upcoming graduation. That is no small feat and deserves to be celebrated. And then let's just do a little reality check here. So firstly, this is so common. Not everyone lands that perfect internship, especially in MedTech where roles are highly regulated and limited. A couple months ago, I attended a STEM career fair at a top 25 nationally ranked school just to witness over 200 candidates waiting in line for their chance to get their minuscule 30 seconds with the hiring manager. And, for most, that was their one shot for consideration. Honestly, the odds are completely stacked against you just based on supply and demand alone. But here's the truth. MedTech companies care far more about your ability to learn fast and apply scientific thinking than whether you've already worked for Abbott, Boston Scientific, or Medtronic. If you can demonstrate initiative, that you've done clinical research projects, senior design work, or anything where you analyze data, wrote protocols, or presented findings, you're already ahead of most. And the key here is that word, initiative. Now, let's pause and think about it for a minute because it extends far beyond what is on your resume. Anytime you have the chance to go the extra mile or do more than just check the box, are you honestly doing it? Be critical of your answer here because any hiring manager will be just that critical. What have you done beyond looking for a role and potentially applying for it? Have you researched roles you'd be a good candidate for as a new grad? Have you sought out and spoken to people doing those roles to learn more and see if they interest you? Have you role-played questions for potential interviews? I know it's not fun to role-play, but it's such an important part of the process. Have you done your company and product research before showing up? Have you learned whatever you can about that hiring manager and planned out the questions you should ask them? Do you even know what is meaningful for them in a candidate? If the answer to any of these is no, then you have not taken the initiative. And these are just a few to consider. Now let's just get back to some tactical things you can do as a starting point. So here's what I would do if I were in your shoes. First, you've got to show evidence of technical application. So upload your senior design project or research summary on your Navro candidate profile, your resume, and social profiles. And don't just list senior design. Every other candidate under the sun is doing that. Add a one-liner like, developed a prototype for a non-invasive cardiac monitoring patch, tested signal accuracy versus ECG baseline. That one sentence tells a hiring manager you understand validation and real-world testing. Make it relevant and make it specific. Show that you know the language and the landscape. You've got to catch their eye with something meaningful to their world. Next, start engaging with MedTech content. You're probably all on LinkedIn, and that's great, but what are you doing on there? Passively waiting for someone to come and tap you on the shoulder will lead you nowhere. It's just not going to happen. Start commenting on LinkedIn posts from industry leaders, like those on Abbott's or Boston Scientific's career pages. The goal here is to show genuine curiosity about the space. And remember, understanding the point about suitable roles for you, well, here's where you should also be searching for folks in those roles and asking them about what they do. In other words, asking for an informational interview. Now, you're not asking for a job here. Rather, you are asking to learn more about what they actually do in their role, about their company, about their industry sector. You may need to be pleasantly persistent to get a couple moments with someone, but that's part of that initiative piece. Finally, Start watching and referencing the MedTech Unplugged webinar series episodes and any other related webinars, podcasts, or blogs. When you talk about industry interest in interviews, reference something real from these sessions. For example, in a Navro webinar recently with Kat Jennings from Boston Scientific's Peripheral Division, I learned how field teams partner with research and development, and that's exactly the type of cross-functional role I'm drawn to. That line alone makes you sound like you've already been part of the industry conversation. It shows that you belong. It demonstrates a love of learning and that initiative to continue to do so. It shows that you understand the industry and its players. And it shows that you are already a few steps ahead of the other candidates. So why does this matter? Well, to a hiring manager, it means less time that they have to devote to getting you up to speed. In short, it gets you noticed. And that's your biggest challenge here, right? Getting noticed. One of the advantages the Navro platform gives you is visibility before you even apply. Hiring managers can filter candidates by university, major, and skills, and many of them simply browse directly looking for that ideal fit for what they need. So even if you don't have experience yet, you're still discoverable. So my advice? Keep your social profile headings specific. Instead of just listing biomedical engineering student, try aspiring field clinical engineer or cardiac rhythm and imaging enthusiast. That communicates focused, and it's what catches attention. So if you're listening and wondering how to break into MedTech without experience, start by showing curiosity, documenting your skills, and getting visible. Remember, the industry is evolving fast. The best candidates aren't the ones who know everything. They're the ones who keep learning. Show that initiative. If you haven't already, head over to mynavro.com, create your free candidate profile, and explore the MedTech Unplugged library and webinar series for insights straight from industry leaders. Thanks for tuning in to this week's Ask Me Anything episode. I'm your host, Jenny Adamou, and I will see you next time on MedTech Unplugged.